started. Hi, everyone. My name is Steve Lawson.
And my name is Anya Fofana.
Welcome to the live scanning sessions for SIGNA Masters, where we'll be highlighting some of our intelligently efficient solutions. So today we are in live from Waukesha, Wisconsin. We are in our SIGNA Architect Bay. And today we'd like to demonstrate to you some of the latest innovations in neuroimaging. So we thought we'd get started by demonstrating some of the hardware first, and then we'll move to the scan console, and we'll be able to scan a volunteer for you. So we're going to step around this side of the table. We do have, for neuroimaging, we do have some really nice tools for being able to image these exams. So this is the 48-channel head coil. So the coil itself comes in two parts. So you have an anterior part, but then also a posterior part. The anterior part, well, both pieces actually have their own dedicated coil, port coil plug. So they are independent of each other. So what that means is if you have a patient, maybe, this is a very large opening already, but if you do have a patient that's head is very large, you're able to use this spacer between the two coils. So you're able to use that to give yourself a little bit more room. So in some cases, you might have a patient that's a very large head, and then you're able to accommodate those particular patients. This coil was made in a collaboration with the NFL, where we were able to use these individuals as a test to be able to see if they fit in the coil. And 99% of the large football players were able to fit inside of it. So it does give great performance, higher SNR, and then also able to get much better parallel imaging compared to traditional coils as well. It does extend all the way down posteriorly to here, so you're able to even do some neck imaging with the coil. Not pictured or not here today, but we do have a mirror that you're able to use to be able to see, out of the bore. If you wanted to use this with an audio system for functional brain imaging, you simply could use this for visual stimulation or whatever with one of those setups.
Okay, I think we wait one more second because I see that we don't see the video stream. And then I think we will resume in a second when we are live again, so that you can see our beautiful new coils. Okay, that looks like we are here again. So that was the first coil we want to show you. That is also air technology in the coil, and we talk a lot about air in different regards today. We start with the coils, so we have air in the head coil. Then I want to show you another air coil, which I have here, which is our 30-element Array A. Not necessarily always a need to scan for neuroimaging, but in some cases you want to combine the head coil with the Array A coil, maybe to do a brachial plexus. That is why I'm really eager to show you this coil as well. And I will use a different camera that you can just maybe appreciate a little bit more the coil itself. And what I really want to highlight is the extension of the coil. This has 30 elements, and this coil has 65 centimeters of coverage. You can see my height is 5'10", that it easily covers on my body the liver and the pelvis in one scan. So it's really a nice coil to do like an abdomen and pelvis scan. You can do combinations with these coils, which is really nice. So as we just showed quickly and briefly, you can do a combination with the 48-channel head coil. So that would mean that you have in combination 48 channels for the head, and then 30 elements anteriorly with the Array A, and then also PA elements on the table. Air technology means that you can do anything with that coil. That means you don't have to follow any rules in regards of combination overlap. You can overlap as much or as less as you want, and the coil will still provide you decent image quality. And now two last coils which we just want to show before we start with the exciting part of the session. I'll just move around maybe.
Okay.
So I want to show you the multi-purpose coils. Short and P coils, multi-purpose, because here we often you to do anything with these coils. So you can use them maybe for joint scanning. You can use them again in combination with the head coil. You can use them for cardio, for small field of view imaging in the pelvis. And these coils come also with a high channel count. So you see, Steve has the medium coil with 20 channels. And here, this is the large coil, which comes with 21 channels. And also here, the same rules apply as on the other air coils. That means you can overlap them as much as you want. You can just like use any combinations you can think of and combine maybe the large with the small one. So that really makes it easy on you to have any type of patient comfortable in the bore and always have enough coverage. And the patient has comfort because these coils are really lightweighted.
Yeah. And Anya mentioned a really good point about having the coils being able to wrap or get close to one another. These coils don't detune or decouple like traditional coils do. So, maybe you have a small anatomy like a hand or a wrist. These coils can be directly on top of one another, and you're still going to maintain excellent image quality with them.
Okay, so now we showed you the hardware with the air coils, and now we want to do really the fun stuff and show you the scanning session live. And since we are going to do scan neuro, we want to do the scan really with a 48 channel brain coil. We have our volunteer ready, so we will ask her to come in so that you can see how nice and easy the positioning is. I will use the other side from the table that you don't have to look at my back. Okay, so we just put our volunteer here on the back. Okay. The metal here, mask noise. So, and the nice thing about that coil, as he showed already, is that it's kind of a two-part. That means the coil, usually you have always issues that the coil has to be connected perfectly with no hair or anything, otherwise you have, again, a bad failure of the coil. These coils are two coils which are working together. So what I can do, have easily here now, put the pillows around her. I don't have to worry about any hair that might get in between coils, because this is just the second coil which goes on top of it. And I plug the second coil in here as well. And that's really an easy and nice workflow. And the nice thing is that if you have bigger heads, you don't have to worry about the space at all. So we start with the 3-plane localizer. I use the IntelliTouch feature here to do a landmark. And then we move the table in.
Push it in. Yeah.
Okay. And then we go outside and look at the user interface. Can we switch camera, please? Can you switch camera, please? Thank you. So now we are here in the user interface outside. You should see that now. And we will start with the 3-plane localizer, which will run for 21 seconds. First, I want to point out here the user interface of the coil management. So no need about thinking which coils to use. You just select the entire coil. And then our feature, which we call Air Touch, will take care about the coil management. And then we start with the 3-plane localizer. One thing which you see, which will kick in automatically on our 3T scanners, is the SAR Scout. So here, before the localizer starts, you see a SAR Scout showing up. That happens all this time when you use a head coil, when you use a certain landmark in order to provide the the SAR management for that particular patient and really do it individually, that we exactly know how much SAR we can allow on that patient, which is really a convenient feature.
Yeah, it really improves your productivity because you're getting the most number of slices for every TR that you can possibly get. This SAR Scout actually measures and sees how much tissue is in the RF field, and then it can calculate how much SAR to deliver, or how much RF to deliver throughout the acquisitions, and then really allows you to maximize the shortest possible TR times.
Yeah, and the nice thing is you don't have to enable anything. The system is smart enough to always understand that you are going to scan a brain, and that the SAR localizer will kick in automatically. So that really is, again, intelligently, like an intelligent solution on the scanner. So you see here the localizer showing up, and then I want to show you two different T2 sequences where we will apply our latest deep learning feature, AirRecon-DL. And I want to talk a little bit more about that in a second. The first thing I just want to mention is our very first deep learning we have in the scanner, which we call RX, which is responsible for slice prescription. So the first deep learning we introduced is slice prescription for brain. We've trained a model to really understand the anatomy of the brain, and only the 3-plane localizer is needed in order to use that feature which is used. So no need for you to run an extra localizer. Whenever you finish the normal 3-plane localizer, all the landmarks have been found from the model, and here in the protocol you can see that you can save it, and you can see landmarks such as the ACPC line, the temporal lobe, the IRC, the OM line, orbits, optic nerve, pituitary, and circle of Willis. Everything is already ready for you after the 3-plane localizer, and there's no need to wait or just think about which landmarks you might need in future. Once the 3-plane localizer is done, you have all the landmarks.
Yeah. Previously, we used a model or an atlas-based approach to be able to find anatomical landmarks. The problem with that is it's just a generic template, and not everybody fits into this template,
Yeah.
right? You might have different ethnic backgrounds or different gender maybe, or something that could cause some variance inside of the algorithm. So, but this type of automated slice prescription uses artificial intelligence, as you mentioned, was trained on 30,000 sets of images to be able to calculate these anatomical reference points and allow you to get accurate slice positioning using artificial intelligence and deep learning. So it's a big difference there.
Yeah. And then we are using now on the first two sequences our second deep learning technique, which is AirRecon-DL. We have trained a software, again, to understand what part of the MR image in the K-space is noise and what is really like responsible to make good images and signal. So what we do here is I show you the same sequence to T2 contrast in the brain, but in two different ways how you can utilize your AirRecon-DL feature. In the first example, I show you how to scan really fast with AirRecon-DL. So in that example, I've switched and scanned the entire brain 4mm slices with really still a decent in-plane resolution. You can see it's 0.6 by 0.6, but we've been really accelerating high in that sequence in order to come up with a scan time of only 48 seconds. So usually you would expect noisy images. Yep. But now when we put AirRecon-DL here, and you can see it has been selected on the user interface with Recon-DL strength high, we are removing all the noise out of the K-space, and you will see that the images will show up with really no noise at all. Yeah.
So having a tool like AirRecon-DL can allow you to be, as you mentioned, scan higher resolution, thinner slices, or even productivity, going faster, or a combination of all of those, right? So that's it's a really nice feature for workflow.
That is why here in the second example, we will scan the same sequence, but scan time will be 2 minutes and 19, because in that we really improve the resolution. So here we are scanning the entire brain in 2mm, and we still have only a scan time of 2 minutes entirely. So the third sequence we want to show is pituitary with really thin slices again and a high implant resolution of 0.4 by 0.4. So we will have a reasonable scan time, 1 minute and 44 seconds, because again, we have selected to use Air Recon DL. So here again, you can see that the Recon DL strength is set to high. And also, we didn't have to prescribe the slices. Since I've used RX here for the slice prescription, you can see the anatomical reference has been set to pituitary. And I will want to acquire sagittal plane, so no need for me to do any slice prescription or to think about where the pituitary is. The system will do that for us.
You can tell the center slice there is perfectly oblique with the volunteer's head. So we had done an experiment several months back where we had the same volunteer and positioned them in 3 different positions. We put that experiment on YouTube if you guys are interested in seeing that. But it was it was nearly identical results for all 3 experiments. We all 3 ran the same protocol, 3 different times, different head positions, and the results were extremely accurate. So
yeah,
that's great.
And here I want to show you the first sequence, which was the fast sequence, acquired in 48 seconds. And I want to show you the comparison with Air Recon DL on the left-hand side and without Air Recon DL on the right-hand side. I want to zoom in slightly a little bit more and maybe go to one of the regions here. So hopefully now you can see that the right image is noisier than the left one, because this is the raw image where Air Recon DL hasn't been applied to. So Air Recon DL is really kind of the first feature in MR. If you are a technologist, then you know what we are talking about, which allows you to have nicer images in less scan time. Usually that's not impossible. That's impossible in MR.
Yeah.
You always have to scan longer to make better images with higher resolution. But with Air Recon DL, we have the first feature in our hand, which allows us to make us better images in less scan time.
That's awesome. Yeah. Air Recon DL is compatible outside of neuroimaging as well, so it's compatible with any 2D FSC or gradient echo that you may run in any anatomy.
And here is the comparison between the fast image and the really high resolution image. Wow. So these are kind of the 2 extremes. You can go with Air Recon DL, like have thin slices. Here they are only 2 millimeter slices, so you have way more images on the right-hand side than on the left-hand side. So it's really up to you if you want to go very fast, if you want to go very high resolution, or as Steve said, you want to go with a happy medium.
Yeah. Can you pull the original set from the Series 3?
Mm-hmm. So the original one is.
There we go. So you often see some ringing and Gibbs artifacts on these images too. Let's see if we can see that. It should be eliminated with Air Recon DL. So if we zoom up on that posterior part of the brain here, you'll see these ringing artifacts that you commonly see are eliminated as well with Air Recon DL. So
cool. So these are the first example how you can speed up with Air Recon DL your Neuro protocols, and then we want to show if you have a 3D sequence how we can speed up our 3D sequences as well. So in that regards, we want to show a 3D cube, so FSE based sequence with FLAIR. We again show like really high resolution images where we acquire in-plane resolution of 1 millimeter. And the scan time here is only 3 minutes and 38 seconds. So I will let that run in a second, and then I will show you how we came up with that scan time. Because on 3D imaging, we can do 2 different HyperWorks features in order to shrink down the scan time. So the first we did is we used compress sensing, which is our hypersense. So in the acceleration tab, you see that hypersense has been selected, and we went to the factor of 1.2. And on top of hypersense, we also applied hypercube, which is when you set the excitation mode to focus, that the phase field of view is not read out entirely, but only until a certain percentage. So you see that the phase field of view, which has been placed here anterior to posterior, is set to 90%. So I just want to like remove all these hyperworks that you can see how fast the scan time would be ending up with the same image without using it. So the scan time would be 1.5 minutes longer without using hyperworks, with the same image quality, just with a longer scan time.
And some anatomies like a cube of the IECs, where you're only interested in the auditory nerves, you could really reduce the phase field of view a lot, even factor or reduce it by a half, and that will cut half of your scan time from. So it can be a nice productivity enhancement too.
Mm-hmm.
So Hypersense is something we've had out for a little while now, but we've made some new enhancements to Hypersense. We've brought it to the 3D gradient echo family. So for brain imaging, you're able to, with brain imaging, you're able to do MP Rage or Bravo with Hypersense now as well. So and I've got some clinical examples that I can show. So looking in the chat, it looks like it says, is it possible to prevent the scanner from calibrating before each scan? So when you change anatomies, the system will do a calibration. Maybe if you're in the head and go to the cervical spine, the scanner will do a coil calibration between those anatomies, because we have something on the scanner called air touch. So the AirTouch algorithm does require a calibration with each change of the anatomies, or if you're outside the coil coverage or whatever within your original scan, but the system will need a calibration for that. As far as pre-scanning goes, you need to pre-scan, usually it's just a few seconds before each individual scan.
Yeah. And the pre-scans, which is nice too. I'm not sure if you're aware of our older platforms. Sometimes you saw like really calibrations happening where you got DICOM images.
Yeah, that's true. Yeah.
And these have been all eliminated and have been shrink down and shortened down, because what we did now is the pure calibration we required before a calibration scan is now edited into the pre-scan, which really allows us now only to see really like MR images here as DICOM images, no calibration scans anymore.
Yep.
And due to that change, the calibration scan has been shortened down to 2 seconds. So it's way faster for the user, and also way easier for the patient. Okay. So while the 3D cube is running, we want to show you just some really clinical images from the field, and Steve will share his screen again. Okay. So
you can see here, this is a full exam scanned with Hypersense. I'm sorry, with Air Recon DL. So Air Recon DL really allowed to get a much faster acquisition time here. So in this case, the entire exam is less than 5 minutes. So sagittal T1, axial T2, axial T2 flare, gradient echo axial diffusion, and then an MRA of the brain as well. So all of these sequences less than 5 minutes. For the diffusions, Anya didn't talk about this, but we've got one more offering in the HyperWorks package. So in addition to Hypersense and Hypercube, we also have Hyperband, and that allows you to reduce the scan time on diffusions as well. So 28 seconds for that. Let's see if the other times here are all less than 30 seconds. A minute 17 for the flare. It's probably the longest scan, just needing to null the spinal fluid. So it takes a little extra time for that, but still pretty quick. And then, much faster T1 sagittal too. The MRA here that we're showing is only 1 minute and 3. So Hypersense really accelerates that one too. So all made possible by Air Recon DL and HyperWorks. Here's an example, is a T1 weighted acquisition in the pituitary gland. So if we look here, the image on the left is a 256 by 192 on the left, and then we have 256 by 256 on the right. But even though the right scan is higher resolution, it's quite a bit faster. So 416 without Air Recon DL. With Air Recon DL, higher resolution, and the scan time went down 2 minutes and 53. So 2 millimeter slices, same scanner we're on today on the SIGNA Architect. So this is a pediatric case, 3-year-old pediatric case. And then, as we mentioned, in addition to having hypersense on the scans that we've had for the past couple of years, we've expanded hypersense offering out to 3D gradient echoes. So this is MP Rage set. So this is an image here on the left, no hypersense. It's 5 minutes and 11 seconds for that one. Without hypersense, the exact same resolution, just simply turning hypersense on, it went down to 3 minutes and 13. Okay, so that's the image in the middle. The image on the far right is an improvement in resolution compared to the original without hypersense. So this one was 240 by 240 on the left. It went up to 300 by 300. Slice thickness, we dropped it, reduced it a little bit too. So, and our scan time is 4 minutes and 40 seconds on the far right. So compared to the original 5 minutes and 11 seconds. So if you wanted to get much higher resolution, maybe you're okay with your current scan times, but you're able to get an improvement in the image quality without taking longer to do that. So some great things, here with our latest software release and our latest innovations. Back over to Anya.
Yeah, maybe just to finish up, because the cube is already done here. This is the one we did in 3 minutes and 38 seconds, where we covered the entire brain with an isotropic voxel of 1 millimeter. And we see that was the original generated plane, but also the reformats here on the right-hand side, we see the actual plane is really nice and in structure. And I can switch also to the coronal plane. So it's really nice to have a 3D volume where you just have to acquire in one direction and you can reformat in any other direction as well. Okay, and while Steve was running, we just did that to finish up. We closed with the top sequence, which here is generated again with hypersense. And in that, we did a high resolution scan again with 0.4 millimeters and ended up with the scan time of only 3 minutes and 4 seconds. And maybe that's a nice image to just close out the session with. I want to show you the top angiography and maybe just quickly change to 3D. So you can see what you can have in 3 minutes and 4 seconds with a 48-channel brain coil. Okay.
Great.
Right.
So we'll be having 2 more of these sessions tomorrow and Thursday, so feel free to join. If there's any questions, I don't see anything else in the chat, but we'll go ahead and close on this. So feel free to join for tomorrow's session and Thursday. We look forward to seeing you guys on those.
Thank you so much.
Thank you.
Bye.
Bye-bye.